Afternoon. I want to take a moment, if we could have the slides up. This past year, we had 26 members of the Institute of Medicine who died and left us only with the legacy of their work and leadership. These are individuals listed here on this slide, luminaries really in the field in every respect, leaders, individuals that taught us, individuals who are our mentors, our colleagues and our friends. And I would just like to take a minute to ask for a moment of silent reflection in memory of our departed members. Thank you very much. One of the founding members who died this past year was Bob Glazer. And I mention Bob in particular, not because the others were not as equally distinguished in their fields, but Bob, in addition to being an incredible leader for academic medicine, the dean of at least 2 medical schools that I'm aware, and then a leader in philanthropy for health, at the Commonwealth, actually, and then at the Kaiser Family Foundation, and then finally leading the Lucille P. Markey Foundation in its support for research. But Bob also stepped forward as the first acting president of the Institute of Medicine. He did that at the request of the then president of the National Academy of Sciences in 1970 and stayed through the better part of 1971 when John Hogness was appointed as our first full president. And it gives me a moment also before I introduce the class of 2011 who were inducted this year, just to take a minute to thank and recognize my predecessors who are here. I want to acknowledge and thank David Hamburg. David was the 3rd president of the Institute of Medicine, along with Betty Hamburg, his wife, and Peggy Hamburg, his daughter. They represent the only family, and I'd love to be corrected, with 3 members of the Institute of Medicine in the immediate family. So that's pretty impressive. David also really set the standard for organization of the enterprise and laid the foundations for much of what we still do to this day. Then Sam Thier, who was our 5th president, came in at a time that was a very difficult time, especially financially, for the Institute of Medicine, and he really pulled it from the doldrums into the forefront. And Sam did an incredible job here before he went on to leadership roles at Brandeis and then at Partners in Boston. And I just want to thank Sam as well so much for his support and leadership here at the IOM. So thank you, Sam. And then my immediate predecessor, Ken Shine, who was the first president of the Institute of Medicine to serve 2 full terms, really took the launch that Sam provided in his term and propelled it forward in a remarkable way. Ken has been a wonderful guide and friend to me throughout the time that I've been here, and I would just want to thank especially and acknowledge the leadership of Kenneth Shine. Thank you, Ken. It's now my great privilege to be able to introduce individually the members of the class of 2011. Many are with us here as the induction class. As I call your name, if you are present, please stand in place. We'll hold our applause until all have been recognized and look forward to that moment. So let's begin. Barbara Abrams. Margarita Alegria, Frederick Alt, Karen Antman, Anthony Atala, Catherine Baker, Carolyn Bertozzi, Martin Blazer, Thomas Boyce, Claire Brindis, Ned Kalange, John Shea, Frank Chervenak, Vivian Chung, Patricia Conrad, Carlo Croce, George Daly, Nancy Davidson, Mark Davis, Joel DeLisa, David Eaton, Diana Farmer, Claire Fraser, Margaret Fuller, Joe Garcia, Atul Gawande, George Georgiou, Daniel Geschwind, Richard Gibbs, Jonathan Gitlin, Glenda Gray, Joe Gray, Stephen Hargarten, Tomas Herkfeldt, Richard Horton, Jennifer House, Richard Huganier, Sharon Inoue, Richard Jackson, Timothy Jost, Yuet Y. Khan, Michael Karen, Michael Lefevre, Roderick Little, Jay Luffler, Joanne Manson, Carol Mason, Jeremy Nathans, Paul Offit, Ora Peskovitz, Christine Petit, Claire Pomeroy, Peter Pronovost, Daniel Rader, David Relman, David Rubino, David Sarawata, James Smith, Jeanette Southpaw, Mriganka Sir, Mark Tessier Levine, James Thrall, David Tyrrell, Liwei Tsai, Abraham Verghese, Barbara Vickery, David Vlahoff, Mark von Zastro, Kunyu Wong, and James Weinstein. Congratulations, one and all. I now have the pleasure to introduce to you, I believe, the fellows of this year. And let me recognize by name, if not by photo, the 2012-2013 Robert Wood Johnson Foundation Health Policy Fellows. They are, and I believe those fellows are here, I'll ask them to stand, Barbara Damron, Karen Domino, Bruce Edgren, Stephen Ferrara, Andrew Gettinger, Harry Hyman, Peter Sokolov, and Hassan Teta. Welcome and congratulations. And now I have the pleasure of introducing this year's Institute of Medicine, American Academy of Nursing, American Nurses Association, and American Nurses Foundation Distinguished Nurse Scholar in Residence. And this year's Nurse Scholar at the IOM is Marla Salmon. This year, we also had the pleasure of beginning a new fellowship program in association with the FDA Tobacco Regulatory Program. And I want to introduce the three fellows who have started in this new, very exciting relationship with the FDA. And they are Atanaska Deneva, Candice Jungsma, and Elizabeth Lapostata. Congratulations. We have also this year two anniversary fellows who are beginning, and I'd like to introduce them to you. You know, the Anniversary Fellows program was initiated at the Institute of Medicine as a way of engaging rising scholars and faculty in the work of the Institute of Medicine, allowing them to remain at their home institutions, enabling them to get a stipend to promote their work, but most importantly to be connected with the board and committee work of the IOM, to have a mentor, and to be able to engage in the policy arena without losing a connection with their home base and their continuing professional development. I'd like to introduce today our fellows, Samuel Johnson, who is the IOM Anniversary Fellow in Pharmacy, and Jennifer DeVoe, who is the James C. Puffer American Board of Internal Medicine Fellow, and also, if our second-year fellows are here, Melissa Simon and Sean David, also inviting them to stand and be recognized, and thank you all very much. I also have a very special announcement that I want to share with you. This year, for the first time, one of our members has stepped forward and endowed a new anniversary fellowship. This will be the Gilbert S. Oman Anniversary Fellow, and we're so grateful to Gilbert and his wife Martha Darling for their generosity and confidence in the work of the Institute of Medicine, and especially in their support of young, rising faculty in this most exciting way. Gilbert, thank you so much. I now have the privilege to introduce this year's recipients of the Rhoda and Bernard Sarnat International Prize in Mental Health that will be awarded at the luncheon for the Sarnat Prize. But I want to say a word because of our benefactor, Dr. Bernard Sarnat, who died last year, almost exactly a full year ago, at the age of 99. And Dr. Sarnat was renowned as a plastic surgeon who pioneered in reconstructive surgery in the face and head and neck. He was a wonderful human being. He and his widow, Rhoda, have just been marvelous supporters and friends to the Institute of Medicine and to medicine more broadly in the United States. This prize, which was really established in 1992, has been a way to recognize and improve the science and health delivery base of mental health sciences and services, which we've already heard several times today how critically important and how frequently neglected they have been in the course of health policy debates and deliberations. This year, I'm especially pleased to be able to share with you the co-recipients of the Rhoda and Bernard Sarnat International Prize in Mental Health, and they are Huda Akil and Stanley J. Watson. Congratulations. Both at the University of Michigan, sharing a passion for their work, and if I may say, a passion for one another. I say that with confidence, as they are wife and husband. And it's a special delight to be able to recognize them for what they have done in illuminating the understanding about emotion and the biology that underlies emotion, the mechanisms of action at the molecular level that affect mood disorders, and pointing the way to potential targets for therapy. It's a privilege and a pleasure to be able to recognize both of you, especially in this shared way, and we look forward to the luncheon program with you both. Thank you very much, and congratulations. I now have the pleasure of introducing the chair of the Gustav O. Lienhard Award Committee, who will be presenting this year's award. The Leonhardt Award is the longest standing continuous recognition offered at the Institute of Medicine. It started in 1986, which makes this the 27th year in which this award has been recognized at the IOM. Gus Lienhardt was the chair of the Robert Wood Johnson Foundation Board of Trustees for 15 years, from 1971 and when it became a national foundation up through 1986. And I'd just like to take a minute to recognize some of the leaders of the foundation who are with us. Risa Lavisa-Moray, the president of the foundation, also former trustees and indeed the president emeritus, Steve Schroeder, also Ruby Hearn, and Gail Warden. Thank you so much for your continued support and engagement with the IOM through the Lienhardt Prize. We appreciate it deeply. And now it's my privilege to call upon the chair of the Lienhardt Selection Committee, Bob Lawrence. He is a professor of environmental health science and health policy and international health, and also directs the Center for a Livable Future at the Bloomberg School of Public Health of Johns Hopkins. It's a great pleasure to welcome to the podium now Robert Lawrence.
I noticed earlier in the day that serving as stagehand must come under the IOM president's job description under duties otherwise assigned. Well, each year the IOM recognizes innovative, creative, and pioneering efforts toward improving personal health services in the U.S. with the Gustav Lienhard Award. I am delighted to announce that the recipient of this year's Lienhard Award is Donald M. Berwick, former president Don is the former president and CEO of the Institute for Healthcare Improvement and former administrator of the Centers for Medicare and Medicaid Services. Don's a pediatrician by training and practiced part-time at the Harvard Community Health Plan for over 20 years. He's best known to this group, however, as a highly esteemed leading authority on healthcare quality improvement and one of the principal catalysts in the movement to improve quality and patient safety. Over the past several decades, his visionary leadership has led to better care and better outcomes. And as Harvey indicated earlier today, he played a key role in two of the seminal reports from the IOM over a decade ago. Early in his career, Don began studying the science of process improvement and applying the manufacturing improvement methods that had been pioneered by W.E. Deming, applying these to the healthcare delivery system. In 1986, he co-founded the National Demonstration Project on Quality Improvement in Healthcare to explore ways to improve safety and quality. Later, he helped establish the Institute for Healthcare Improvement, or IHI, an incubator for developing new concepts and approaches to improving safety and quality. Under his nearly 20-year tenure as IHI's president and CEO, the Institute challenged and upended assumptions about hospital-acquired infections, patient falls, and other negative outcomes of hospital stays and showed that these were avoidable. The right number of errors to aim for, Don says, is 0. IHI pioneered numerous practices that are now standards, including protocols that have dramatically reduced the incidence of patients becoming infected through infusion tubes in hospital ICUs. IHI has disseminated these and other improvement strategies through its forums and activities and has engaged thousands of clinicians and institutions in improving the reliability and safety of care. Don's expertise also made him an invaluable member of the committee that authored the two IOM reports previously mentioned, To Err is Human and Crossing the Quality Chasm. And I'm delighted to learn that he's now working with Gail Walensky on what will, I'm sure, be another very important report. These reports helped raise national awareness of the systemic factors that lead to medical mishaps and identified 6 fundamental principles of quality health care that have been widely adopted. Don's influence has shaped not only healthcare practice, but also its policy. His work has fundamentally changed the orientation and operation of the Joint Commission, helped define AHRQ's quality research agenda, and inspired the founding of the National Committee for Quality Assurance and the National Quality Forum, or NQF. In 2010, President Obama selected him to serve as CMS Administrator. In this position, he launched an ambitious program called Partnerships for Patients, which aims to reduce hospital-acquired conditions by 40% and hospital readmissions by 20% by next year. He also partnered with the CDC to initiate the Million Hearts campaign to reduce heart attacks and strokes by 1 million over 5 years through enhanced prevention methods. At every point in his career, Don has provided inspirational vision and practical guidance for healthcare improvement. He has defined the field, trained providers, and made safer, better care a reality for hundreds of thousands of people. On behalf of the Leonhardt Selection Committee, I'm delighted to honor his extraordinary achievements and present this year's Gustav Lienhard Award to Donald M. Berwick.
I'm a bit speechless. I want to thank Bob for those gracious remarks and the committee for this selection. The work that I had the privilege to be engaged in reflects not my own efforts in much measure, but really the community of effort around the world to help make healthcare better. And it's just a privilege to get to work with the people of the quality and commitment and vision and integrity that I do every single day. In that work, the Institute of Medicine has been pivotal. The two reports I was privileged to be engaged in that are mentioned were clearly turning points in the field that I get to participate in. So I'm deeply honored and feel very humbled by this. Thank you so much, Bob.
Well, again, congratulations to all of our fellows, our new members, our award recipients. It's a thrill to be part of the enterprise where you can be recognized in this way. I want to invite everyone now to enjoy active, engaged conversation together over lunch. Some of you, I know, will want to talk just with one another, but I do want to urge those who are interested to join either the Committee on Human Rights, which will have its luncheon in the lecture room, or if you are interested, there will be a luncheon that will discuss estate planning, and that will be available in room 125. The general luncheon will also be open out at the tent, and we will reconvene promptly at 1:45 p.m. to have our continuing program. Thank you all very much. See you at 1:45.